Good morning, good afternoon, good evening, wherever you are in the world, and welcome to the Supporting Nurses in Conflict Areas webinar. I am Mark Lazenby, Dean of the Sue and Bill Gross School of Nursing at the University of California, Irvine. This webinar was born out of a deep concern for the nurses impacted by ongoing conflicts worldwide. Recognizing our colleagues' immense pressure, my colleagues, Deans Antonio Biorruel from the University of Pennsylvania and Azita Imami from Yale University, and I came together to explore how we can support our colleagues during these challenging times. We believe that nurses in conflict areas need more than recognition. They need practical support, resources, advocacy, and financial support to continue their essential work despite the extreme circumstances. That belief drove us to reach out to the International Council of Nurses, and from there, this webinar took shape. We are grateful to Cheryl Peterson from the American Nurses Association for joining us as a sponsor. I'd like now to introduce Dr. Pamela Cipriano, President of the International Council of Nurses, who has been a driving force behind today's event. Dr. Cipriano will guide us through the program and highlight the ICN's important work to support nurses in conflict areas. Dr. Cipriano.
Thank you so much, Dr. Lazenby, and I am very appreciative for the opportunity for ICN to join together with the American Nurses Association, our member, the UC Irvine, Sue and Bill Gross School of Nursing, the University of Pennsylvania School of Nursing, and Yale School of Nursing to bring this webinar to you today. We're joined by experts who are experiencing conflict in their own countries or who see firsthand the effects of leading international relief efforts from near and far. For some of the countries that you'll hear us mention, it's very difficult for them to respond in intense situations. So we're not able to bring to you content from everywhere of the countries we're working with, but a snapshot of those who have been able to weather these storms for quite a while and who are making amazing efforts on the ground. You're also going to hear from our deans and hear suggestions about how they believe we can, as educational institutions and organizations, bring help in solidarity and support for nurses who are in the midst of crisis and the aftermath of recovery. We'll also have an opportunity to have some of our panelists reflect on what they've heard and comment a little bit more about how we can all do our part to help. If you have questions that arise during the webinar, please use the Q&A section at the bottom of the screen. Click on Q&A and enter your question. We may be able to answer some in real time and as many as we can in the conversation at the end of the webinar. You also can find the biographies of all the speakers under the resource tab. So if you click on resources, you'll see speakers, and so you'll get more in-depth coverage of their background. Also, for those of you who are looking for Spanish and French translation, there will be the links again in the chat. Hopefully you saw those as you were signing on, but we will make sure that those are available. ICN truly appreciates everyone's efforts, again, to show solidarity and support as we realize the enormous impact of crisis and disasters that affect all of our colleagues. And we know that none of us are safe unless all of us are safe. Now I would next like to introduce our first speaker, who's going to tell us about the international landscape and humanitarian efforts to support nurses, as well as some of these direct relief efforts worldwide. So it's my pleasure to introduce Howard Catton, the CEO of the International Council of Nurses.
Good morning, good afternoon, good evening, everyone. Absolute pleasure to be with you all. Can I just check, are you hearing and seeing me?
Need to put your video on.
Yeah, it's on. It says, my screen says that I'm still joining the webinar. So I've hit join the webinar and my screen says that I'm in the process of joining still. Anthony, I don't know if you can just accelerate the process to put me in.
We can hear you though.
Okay. Can you see my first? Can you see my first slide? Great stuff.
Yes.
Okay, go ahead. Let me also
Yes,
add.
we can hear you.
Great stuff. Let me also then add my my thanks and appreciation to our supporters for today's event, for UCO and to Penn, to Yale Nursing, and of course to our member association in the US, the American Nurses Association. And also a number of the speakers you're going to be hearing from have been working very, very closely with ICN over recent months as well. And I'm grateful hugely to them for their support. Next slide, please. I'm sure you all do know ICN is the internationally recognized body for nursing. Our membership, our national nursing associations, more than 130, representing now in excess of 28 million nurses from right the way around the world. This is our 125th year anniversary. And when I look back at the ICN history, you can see from those very early days, back for 1899 up until the First World War, the principles of supporting nurses in conflict and disaster zones, the relationship between health and humanitarian support, the fight for ensuring rights, justice, were there at the very beginning of ICN's history. But there have been significant world events which have seen ICN develop its role. When I look at the impact of the First and Second World Wars, you could see ICN stressing much more the relationship between health and peace, peace being a requisite for health and health outcomes. You can see the relationship with ICRC develop between the nursing profession and ICRC between the wars. You could also see early in ICN's history a concern for displaced nurses and refugees as well. Next slide, please. This is just an overview of the role of nurses in disaster management, just in terms of some of the big global numbers that we currently know. 1.6 billion people currently living in settings of conflict, displacement, and natural disasters. And current estimates from WHO, they're up to 300 million people in need in this year, in 2024, of humanitarian support. We're all familiar with the key roles that nurses play in terms of providing disaster management support, from mitigation, including risk reduction, health education, policy advocacy, through to preparedness and training and emergency planning, ensuring sufficient supplies of equipment, the response itself in terms of frontline provision, triage coordination, public health support, and then recovery of health systems and population health afterwards in relation to rehabilitation, community reintegration. We know these things, but important just to set out these different areas of focus, because a lot of people just assume that the nursing, the health response is at the response stage and don't see these other key and critical areas of responsibility. I'm going to talk a little bit now, next slide please, of ICN's work since around about the start of this century. We started to develop the first set of disaster nursing competencies early part of the 21st century. And I'd just like to give special recognition to Christine Gebbe, who's no longer sadly with us, but was absolutely key as a disaster nursing expert in helping us bring forward these competencies.
Well, I'll tell you what, let me try to fill in for Howard. And when he comes back in, we will keep going. But if just to conclude on this slide, again, what we found was that it was really critically important to be able to address the needs that nurses need to learn right at the early stages in terms of understanding disaster nursing, but also at an advanced level, which is really more team-based care. So we believed that it was very important to do these standards. And so they have been in place for several years now, and we're realizing that they have become critical in terms of the education in many of our countries. If you go to the next slide, please. So ICN has been very involved in addressing humanitarian needs as well. And as Howard said, it's not just early on in the disaster relief efforts, but it is ongoing. And even though our disaster relief fund was started early on in 2010, uh, it actually sat a little bit dormant for a while. So the initial impetus was the earthquake in Haiti, but then we began to see ongoing escalation of conditions that really required humanitarian support throughout the 2010 decade and into 2020. So unfortunately, we have seen that parallel worldwide events that have put nurses in the course of danger and really called on them to step up. When we think about these events, I just recently re-looked at the video that we received from the Beirut explosion, where they had 3 hospitals completely destroyed and nurses were working in just unbelievable conditions where their work setting had been destroyed, and they were supporting all kinds of immediate triage and first aid and movement of patients. So we know that there are just incredible efforts that are happening. Same with responding to the COVID pandemic. And then also the biggest impetus was the unfortunate attack on Ukraine and the hostilities there. And that really was the impetus for Nurses for Peace to grow exponentially with the generosity of many of our nursing associations around the world and other individual and organizational donations. So since 2023, you see a list of some of the countries that we have helped, primarily earthquakes and famine and political unrest, military coups, aggression, wars. And so what we're able to do is not only provide direct financial aid to nurses in certain situations, but also advocacy, training, bringing courses virtually as well as on site to help nurses in their roles. Next slide, please. So the policy that we have developed allows us to look at what types of support can be provided. And I won't go into detail on this, but just so that you know, we've taken a really careful look at how we make decisions to be able to provide support and looking at additional areas where we are in the area of mental health support for nurses on the ground, as well as we have helped in neighboring countries where there is service delivery to refugees and helping to strengthen those efforts and those associations. So it really runs the gamut: direct supplies, direct nurse financial support, to everything from strengthening associations so that they're better able to respond in the course of these actions. Next slide, please. Nurses for Peace, again, took off exponentially with the war in Ukraine. And so we have had a longstanding relationship in terms of staying in touch with what has been happening, and learned very early on how dangerous it was for nurses. And even today, you may have read some of the reports about nurses living in their hospitals. That is still happening today, more than 2 years on. And so as we look at some of the issues, we've seen mental health as a key issue, that as these crises and the trauma and the aftermath continues to affect nurses. But at the same time, they are exhibiting amazing resilience and really looking at being able to identify how their associations can continue to help them. Training and seminars. We're also bringing a leadership development course. We've been in touch with the chief nurse. You'll hear a little bit later on today from the nurse president of the Ukrainian Nurses Association. And so from afar and also in the region, we have been able to help with some of the relief efforts. Next slide is a statement from Tatiana Chernyshenko, who is the president of the Ukraine Nurses Association. And this has, again, been a very special effort that we had support from many of our associations to make sure that supplies were mobilized, to make sure that monies were mobilized, to make sure that care of refugees, also the repatriation as could happen with Ukrainian nurses, and also helping them find ways for those who left the country to work in other locations, because education is not identical across the European regions. So we have been able to help many, many nurses from Ukraine. Next slide, please. Again, I've mentioned some of the surrounding countries. These are the nursing associations that you see: Moldova, Poland, Romania, and Slovakia. that have been directly supporting Ukrainian nurses, both in country as well as when they are their own refugees, and then also the care of refugees who come with nothing more than the shirt on their back, and providing supplies and medications and transportation and all of the things that we know is absolutely critical. Next slide. We also have had, again, significant efforts that you'll hear a little bit more about in terms of Afghanistan, where, again, our Nurses Association there has been very resilient and has been able to identify how help with enhancing teaching and practice skills has been really important, and particularly focused on emergency response. They've done extensive work in basic life support training, which you'll hear about. And then, as we all know, enhancing leadership education is also truly critical. One of the other issues that we know affects Afghanistan is at times the advocacy for women's rights is not where it needs to be. And so we have been vocal about gender equality and trying to make sure that we support women in particular so that they're getting the education that they need to be fully prepared healthcare providers. And again, I know our Nurses Association is instrumental in moving that agenda as well. The next slide, please. Again, you're going to be hearing from our leader in Sudan, and it's very important to know that workforce capacity building has been an important part of their emergency response as well. It's not something you think about every day unless you are in this position of crisis and threat. And so for most of our listeners who are probably from the United States, I think it is a wake-up call that at any time, organizations can be subject in their countries to really having to step up and respond. And so the training and rapid deployment and response is really critical, and you will hear more about that. Now, we also, as you see on the right side of your screen, we have been actively supporting our nurses associations in Israel and Palestine. We know that the humanitarian needs are tremendous, as well as the ongoing mental health needs in both countries. And so we're working with our nurses associations to be sure that we are focusing on how we can best support nurses who not only have been in stages of peril and huge loss and have significant mental health needs and bereavement needs. And again, each country is a little bit different, but again, reaching out through our Nurses for Peace campaign to help nurses in both of those countries. Next slide. We've been fortunate to be able to have some important partnerships. The first one that you see is Project Kesher, and this is an interesting project. This group has established an e-bike program to be able to mobilize nurses to get into lesser served communities in their rural areas. So ICN's contribution was to fund 10 e-bikes in this pilot project. And so they've been able to really optimize travel time for nurses to get to communities that have been underserved. So this has been really helpful. We think it's an exciting and growing project, and it helps, again, worker safety. It also helps the nurses know how meaningful their work is, as well as how much more quickly they can get to providing care in their communities. The next is on the right-hand side is a new relationship that we've just restarted with a pretty incredible relief organization called Direct Relief. We were put in touch with them as a group that has provided, over $1 billion more in recent times to providing relief on the ground to any area in conflict. And so with Direct Relief, in addition to recognizing their overall humanitarian logistics, and they have a very strong presence in terms of pharmacy support, but they have entered into a partnership with ICN so that we have a nurse consultant who is going to help bring intelligence about nursing and health conditions in our communities on the ground in real time, so that not only can Direct Relief have more intel, but also be able then to have access to individuals who are in these vulnerable populations, to be able to leverage the nursing expertise and connections in countries where they want to be able to respond as rapidly and thoroughly as possible. And they have an amazing global reach. We are so pleased to be able to join them in this new effort. Next slide, please. This visual tells a lot. And we know, again, that you're going to hear from some experts who are providing support in intense conflict situations, both in the immediate and then aftermath conditions. And so we know how important it is to protect nurses and other healthcare professionals who are trying to help. We are part of the Safeguarding Health in Coalition, Health in Conflict Coalition, and this is a major effort to keep health workers safe. We have called on the UN Attorney General in a letter that I sent last month to please stop the attacks on nurses in healthcare facilities. We need to have the international law invoked to prevent the disregard for the lives of healthcare workers, as we've seen in many countries. We also, as part of the World Health Professions Alliance, have sent out numerous statements to safeguard health workers in facilities worldwide, to call for ceasefire, more recently in areas in Gaza, as well as, again, being able to focus on the humanitarian needs around the world. And fundamental to that is keeping our health workers safe. We've also had 70 WHO member states receive presentations about Nurses for Peace. So the word is getting out, and recognizing that we have to be able to do more to reduce the healthcare in danger, which is our ultimate goal and part of the great partnership we have with the International Committee on the Red Cross. Again, you'll be hearing about that more in just a few minutes. So just next slide, please. A quick recap on the Nurses for Peace campaign. We've been able to engage with millions of people to understand, and most of these are nurses, to understand what we're doing, to be able to get signatories to, again, support public positions, and also to be able to strengthen the relationships between our member associations and all the individuals that they're working with. If we go to the next slide, please, again, just a summary in terms of all of our humanitarian efforts and why this fund is so important and how it's empowering us to help nurses around the world to be able to respond to crises, both in the short and long term, to be able to provide key skills and build leadership capacity, to work with other humanitarian organizations to more rapidly meet local needs, to have a responsive network and be able to make sure that we can bring intelligence on the ground to be able to respond as quickly as possible. So thank you. And I am so sorry that we lost Howard in the process, because I know he also brings an intense passion to this issue, and we're very proud of those efforts. So I would now like to introduce our next section, and we're going to hear from Muafag Hassan Hashim, who is the president of the Sudanese Nurses Association, and he's going to share his experiences with you.
Yes, hello. Good night, everyone. Nice to meet you all. I'm Muafag Hassan, the president of Sudanese Nursing Organization. It is a national association from Sudan. Next slide. Next. In this presentation, I will give brief about how we respond in Sudan during Sudan conflict. I mainly will speak about the ERT, Emergency Response Team. This is a part of our response as Sudanese nursing organizations for people in Sudan and how we manage our conflict. Next slide, please. Since April 2023, the intense fighting in Sudan has led to violence, leaving more than 11 million people in need of urgent health care. The insecurity makes the delivery of health care increasingly challenging. More than 2/3 of all hospitals in affected areas are out of service. Repeated attack on health care are preventing patients and health workers from reaching hospitals and getting treated. With health facilities, medical warehouse, transportation of supplies, and health workers being targeted. The disease surveillance system has been disrupted, posing serious challenge to detect and confirm infectious disease outbreak. I will show later on in this presentation how the effect of surveillance system affects the Sudanese people, especially in terms of epidemic. Many of Sudanese people have been filleted as refugees or as IDPs in Chad, Central African Republic, Egypt, Ethiopia, and South Sudan. The ongoing conflict has badly disrupted healthcare services, leaving many people vulnerable to disease outbreak during this time of conflict. 71 health and medical personnel have been killed. Next. In terms of IDPs and refugees disruption, there is more than 10 million have been forcibly displaced. This is internally displaced. There is also more than 2 millions self-relocated refugees and more than 1 million newly arrived refugees. About newly arrived refugees, there is two kinds, newly arrived refugees from other countries, for example, from Ethiopia, because there is also conflict, or in or returnees. For example, also there is some Sudanese people, they flee to near countries and then they return back to Sudan. Next slide. Current health emergency in Sudan, we have more than 3 current health emergencies, but in this presentation, I mainly focus on cholera, eye infections, and floods. Next slide. In cholera, there is more than 6,900 cases, with total deaths more than 242. For eye infection, the eye infection rate increased from up to 2,800. And also there is heavy flood and rains. The impacted of more than 2,000 people and killing more than 38, leading out more than 6,000 damaged houses. Next slide. Next. Next also. Next. For us, as a Sudanese nurses organizations, we made a survey to evaluate the impact of conflict on Sudanese nurses. We found that there is many of Sudanese nurses have been fleet. Most of them was working in Khartoum state. Afterwards, they are fleet to near state, Kasala, Gadarif, Madani, and then they fleet again from Madani, Jazira state, to another areas, safe areas. We found that more than 72 of the nurses are currently not working and have not received support from organizations. This information highlight 97% challenge and difficulties faced by nurses in Sudan post-war. It is important to address these issues and provide support to healthcare workers who are essential in rebuilding and strengthening the healthcare system in the country. Next. The challenge we are facing in Sudan, especially for nurses, safety and security, safety and security, resources scarcity, ethical dilemma, displacement and unemployment, lack or absence of financial support. When we are speaking about these general challenges, we are explaining there is no direct fund for the nurses. There is a fund or there is support as general for civilian, so but not direct support for Sudanese nurses. Next. Uh, Next. As Sudanese nurses organizations, we have many response activities. First, we thank ICN and G4 Alliance for their solidarity and they sharing our petitions, which was targeted to grab the attention of international community to work on stop Sudan conflict. We decentralized our office from Khartoum to northern state as it is one of the low running costs State in support with Marawi University of Science and Technology. We reactivate our national capacity building program under the support of the ICN. We also have activities about nursing talk about Sudan campaign, which the Sudanese nurses share their testimonies about what they witnessed during Sudan conflict. There is many nurses share their witness. It was badly. It was many violation of international humanitarian law. We established Sudan emergency response team as SNO working in different sectors. We are also as a response to the epidemic for cholera, for eye infections, and for floods. Next. 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 What is the SNO emergency response team? This is a group of individuals trained to respond to various emergencies such as natural disasters, health crises. As we are now facing cholera, we are also eye infections. We're facing floods. There is also snake bite. All of this. The team is consists from 15 members in 3 cities: Marawi, Dongola, and Kordofan. The members are ready to be deployed at any time to anywhere in Sudan to respond to disaster. When we are talking about disaster, we can talk now about natural disaster, floods, and also we can talk about man-made disaster for conflict, for treating injury, and all of this. Next. The main function of ERT are assessment and surveillance, planning and coordination, communication, medical response, logistic and support, training and educations, recovery and evaluations. Next. Next. Why we have ERT Sudan? We need to master emergency medical and psychological response as an effect of conflict. There is a psychological effect on nurses and also on civilians. And that is why we have basic life support, and also we have psychological first aid support. One of the main courses we are training our ERT on, and we support them to implement this during their present in their work. In hospital or in community, we have 2 levels of intervention: community-related interventions and also health facility interventions. We also aim to foster the ability to provide psychological first aid, ensuring a holistic approach to emergency care, consultative leadership and team dynamic, enhance communication skills, advance professional and personal development, creative problem solving and documentations. Next. Next. This is some pictures documenting the preparation of ERT team, including training about the IBC, also including training about the BLS. Next. The main training or the main capacity for ERT team is include basic life support, psychological first aid, trauma management, infection prevention and control, communication in emergencies, team building, report writing, triaging and sorting, nursing ethics, documentation skills, effective communication skills, team building, empathy and compassionate teamwork. Next. Next. In level of intervention, we have 2 levels of intervention: community level and health facility level. In community level, we train community members to handle potential crisis, coordination with local authorities and direct community health workers, volunteers, providing emotional and psychological support during and after disasters, educating and training community members through health awareness campaign and community outreach. This is mainly as we have cholera outbreak, we have activities about community outreach, community awareness about the health and how they can improve health during this time. In health facility levels, we regulate training to ensure that healthcare staff are well prepared to handle emergencies, facilitate clear communication between different healthcare providers, work closely with other emergency services and departments to ensure a coordinated response, ready to be deployed as first responder to provide vital care during emergencies. Next. One of the challenges we are facing now are funding and resource limitations, accessibility and coordination, communication instability, long processing time for program and activities. This is the main challenge we are facing as Sudanese nurses when we are trying to conducting our activities. Of course, there is many other challenge, but this is the main challenge that we are facing to coordinate our activity. Next. Thank you. If there is any questions, I will be in Q&A. Thank you.
Thank you so much. We appreciate hearing the stories of displacement and how difficult it is to be able to rebuild and strengthen your health system when you're dealing with so much adversity. But the work that you've done with the SRO emergency response team has been really important and very critical in terms of being able to mount that critical response. So thank you. We're next going to hear from Wais Mohammed Karani, who's president of the Afghanistan Nursing and Midwifery Council.
Hello and assalamu alaikum, everyone. Thank you so much. First of all, I will express my deepest gratitude to the organizer of this webinar for giving me a chance to talk about Afghanistan and what we can do to improve nursing and healthcare in the country. Next, please. During my presentation, I will brief you about the current situation of Afghanistan and how it is affecting us in terms of social well-being, healthcare, and also economy. Next, please. Ladies and gentlemen, it is important to know that Afghanistan is geographically considered as a hub and corridor where South Asia, Central Asia, and West Asia meet. However, it is a landlocked and mountainous country which has negatively affected us in terms of economy and also in terms of access to healthcare, particularly during winter when the roads and transport means are blocked and there are areas in the very remote countries of the remote areas of the country where for months no one can go and healthcare access is a big challenge. Next, please. Before I talk about the challenges or relates to what we are facing, let's understand how the current situation in the country is. You all know that as of August 2021, when the entire government was changed, there are a huge number of people, around 8 million Afghans have left the country and they have migrated to other countries. And they were mainly educated people and also economically in a good condition. So you can imagine that 8 million people who are educated mainly and economically better have left the country, what the impact will be on every aspect of the life. The economy of the country has contracted 26% in 2023. Education and employment is an issue these days. And this is despite that during 2023 and 2024, we had a number of natural disasters, including flood and earthquake, and adding to that expel of and forceful expel of migrants from neighboring countries. nearly 2.5 million people have been displaced internally, which is impacting the economy and also impacting the healthcare and how to reach to these people. The government recognition is a big issue, which further deteriorates the humanitarian issue and also the social and economic crisis of the country. There is no developmental fund coming to the country. The only thing which is again and still scarce is the humanitarian fund, which is even not covering a very minor number of people in the country. Next. Next, please. Now let me talk about nursing and midwifery structure in Afghanistan. Sorry, one slide back. One slide back. I will mainly focus on nursing education because you know that in Afghanistan, having around 38 million population, we have only one program which prepare nurses at the bachelor level. And on yearly basis, they graduate around 50 students. So you can imagine in terms of level of education of the nurses in the country. While the diploma level education has been phased out from other part of the world, we are still have diploma programs, and majority of our education programs at the diploma level. We are having 11 nursing programs, which is under the government sector. 3 nursing programs are supported by the NGOs, and 164 institutions prepare nurses at the diploma level in the private sector. And this is really a big challenge because we are not sure about the quality of the students or the graduates who are graduating from the private sector. The positive aspect is that the only education available for the women, for the girl, is nursing and midwifery currently, and that is at the diploma level. But on the other hand, the quality of this education is a big challenge, and we need to work how to improve the quality of nursing education in the private sector. Next, please. This is the only available data from WHO, which from the survey, which was done in 2020. On the left side, you can see that in terms of accreditation of the education program, particularly when we are talking about the private sector, we have nothing. Similarly, in terms of continuous professional development, we have nothing. And above all, in regard to the governance and leadership, we are equal to no. We have nothing in the government sector in terms of leadership in nursing and midwifery. On the right side, you can see the density of the nurses in the country, which is 1.8, while we all understand that it should be more than 30. And similarly, when you see the percentage of the nurses as compared to the entire health workforce in a health system, it is just 31%, while it should be vice versa. Unfortunately, this is what the condition of the nursing in Afghanistan is, which indicates that we need to improve on quality and also on the aspect of quantity too. Next. I have listed number of challenges, and we were mostly talking about majority of these challenges some time back. But now they are not our priorities. Our priority is to survive and sustain what we have. I don't want to further talk on this. So this is what our situation is in terms of nursing in Afghanistan. Next, please. So our recommendation is that what we can do to improve and support in the operation of the Afghanistan Nurses Association because without their development, without their existence, we may not be able to further improve or work on other interventions. In Afghanistan, nurses are developed generally, so post-basic diploma in nursing specialization is a requirement these days, and we should prepare nurses in critical care, emergency, oncology, and many other aspects which the country is needing right now. Supporting the private sector to improve the quality of nursing education is an important aspect to improve the education, which ultimately improve patient outcome. Provision of continuous professional development is another area which we can do a lot. And our expectation from WHO is much more from what they are doing today in Afghanistan. And we are thinking and suggesting that what WHO can do based on the global strategic direction for nursing and midwifery in Afghanistan. Next. At the end, I'm very grateful and acknowledge the support of the ICN during 2023 and also 2024, which supported our education programs, CPD programs, through which we were able to train 60 nurses in the country, and it had a very positive impact in the performance of the nurses, and also in the improvement and the quality of the nursing practice in those areas which they have got the training, particularly when, as it was shared in the beginning, the basic life support and also the leadership and management, and also the effective teaching skills course. In conclusion, I would say that let's separate healthcare from the politics and see what we can do and jointly work for the improvement of healthcare, particularly nursing, which will ultimately improve patient outcome and public safety. Thank you so much.
Thank you, Wes, particularly for sharing again some of the real challenges with displacement, and then also the simultaneous challenges that you're working on in terms of improving quality of education and quality of care. So thank you very much. If we would go to the next slide, we have a video presentation that will be shared with you from Tatiana Chernyshenko. It has subtitles that you'll be able to read in English and hear her message about the situation in Ukraine. So if we'd move to the next slide in the video, please.
В Україні з 2014 року відбувається жорстока війна. З лютого 2022 року повномасштабне вторгнення російських військ. Кожного дня, вдень і вночі, російська армія завдає ударів ракетами, шахедами, Збройним силам України, мирному населенню, руйнуючи при цьому будинки, лікарні, енергетичні об'єкти, заклади освіти. Страшною трагедією стало обстрілювання російськими ракетами Національної дитячої лікарні Охматдит у Києві, де загинули маленькі пацієнти, діти, медичні працівники населення. Багато хто із них отримали тяжкі поранення. Не дивлячись на тяжку і стресову ситуацію, лікарі і медичні сестри продовжували робити розпочате раніше оперативне втручання і надавати адекватну медичну допомогу. Нещодавно російськими ракетами був приліт до міста Полтава, і в результаті цього загинули в Інституті зв'язку 57 людей, а 300 людей отримали поранення. Ранкові ракетні прильоти зранку відбуваються у Львові, Києві, Чернігові, Дніпрі, Сумах, Херсоні, Одесі, Кривому Розі, Нікополі та інших містах. Гине мирне населення, гинуть діти. В таких жахливих умовах живуть і працюють українці. Перед українськими медиками, лікарями, медичними сестрами постає багато питань, які перш за все стосуються збереження життя людей, надання невідкладної медичної допомоги усім верствам населення, які її потребують. Під час воєнних дій Наші лікарі і медичні сестри проводять оперативні втручання у будь-яких, а іноді зовсім тих умов, які не можна в мирному житті проводити оперативні втручання і рятують поранених бійців, надаючи невідкладну медичну допомогу. Тому одним із головних завдань Асоціація медичних сестер України здійснює заходи щодо підтримання рівня кваліфікації у медичних сестер і проводить навчальні семінари. Звичайно, враховуючи воєнну ситуацію в Україні, майже в усіх регіонах заходи проводяться в режимі, як правило, онлайн. Перш за все, це стосується зупинки кровотеч, в тому числі і в польових умовах. Правильність накладання турникетів та навчання цьому самих бійців. Медичні сестри часто зустрічаються з різного роду травмами, ампутаціями кінцівок серед наших захисників. Тому для медичних сестер дуже важливим є розуміння особливостей медсестринського догляду за такими пацієнтами і психологічна підтримка наших героїв та їх сімей. Медичні сестри працюють з усіма верствами населення, в тому числі і дитячого віку. Тому важливим є надання психологічної підтримки пацієнтам, в тому числі і при зґвалтуваннях, яке пережило наше населення на окупованих територіях, особливо на початку війни, а зараз переживає на окупованих територіях. Війна посилає населенню важкі і неочікувані випробування. Це викликано тими життєвими обставинами, з якими може зустрітися будь-хто з населення. Так навіть деяким медичним сестрам, акушеркам приходилося і приходиться надавати допомогу і проводити пологи. Медичні сестри, які працюють в лікарнях, поліклініках, несуть медсестринську вахту і забезпечують дотримання вимог санітарного режиму та систематичного проведення дезінфекційних заходів. Часто можна почути, що медичні сестри майже живуть у своїх лікарнях. Особливо це стосується при проведенні активних бойових дій, а це відбувається в різних регіонах постійно. Для усіх медичних працівників надзвичайно важливим є подолання стресу, підтримання свого психологічного здоров'я і психологічної рівноваги. Особливо це стосується медичних сестер, які найбільше перебувають біля пацієнтів і спілкуються з ними та їх родинами. Тому ми повинні цим питанням приділяти постійно особливу увагу. Щиро дякуємо Міжнародній раді медичних сестер, всім асоціаціях медичних сестер демократичного світу за ту велику допомогу і вагому, яку ви надаєте нам, українським сестрам. Це має для нас велике значення.
We have two experts in global relief efforts, and you're going to hear next from Filippo Gatti, who is the chief nurse of the International Committee of the Red Cross.
Thank you very much. Can you see me and hear me?
Yes, we can.
Very good. Good morning, afternoon, and good evening to everyone. I will do a brief introduction of what we do for providing care in conflicts and also to help colleagues, especially nurses, during their work in the front line. Next slide, please. The International Committee of the Red Cross, it's all present in more than 80 countries, supporting the healthcare in affected and zone from armed conflicts, and plays a crucial role in supporting healthcare providers. Next slide, please. In most of the environment where we are working, we see that the environment is, it can be such clean and neat, but then suddenly, because of a conflict, things are changing and the level of stress, it's increasing, the conditions are worsening, and we need to be prepared. We need to prepare our staff to do so. Next slide. And the environment can change in some places where the healthcare system is not yet developed or collapsed, or maybe it was working before, but then suddenly have been affected. The situation can change, and when there are hospitals, there are no hospitals suddenly. And we are providing structures like this example. It's a field hospital that is set up in Gaza Strip now, which has a totally different aspect or environment. It's a tented hospital, so in terms of security, for example, there are a lot of challenges, workload, because it's a area that is affected by several conflicts or mass casualties. So the situation can be different every minute, and we need to be prepared. Next slide, please. And in these areas, if you see these pictures, it seems like a moon landscape, and you can say, okay, this is what left after a conflict, but this is not only what's left, because if you click on the next slide, you can see that in these images are appearing, please click next, are appearing a lot of unexploded devices that could be potentially harmful for not only health staff who is maybe walking to go to the hospital to work, but also for the civilian population who is present in the area. Next slide. As I said, we have limited technical environment, and we have to work with that. We can have damage or incomplete infrastructure with limited access to water, sanitation, electricity. We can have lack of local human resources for security, for access, for motivation, for fear, a lot of reasons. Lack of experience human resources, might be expats coming from out, or as mentioned by some other colleagues previously, because there is a brain drain and some people are not there anymore in the context. There are lack of competencies, knowledge, adaptability, there is fatigue, lack of appropriate equipment and supplies. In some places we don't have X-ray, we don't have CT scan, we don't have all the lab features. We might not have a blood bank, or lack of blood for transfusion. Next slide. If we think about a bit of the epidemiology of war, a lot of the weapon wounded related to gunshot wound, mine, blast, and let's say out of 100 wounded, we can see that 20 to 30% maybe doesn't require surgery. They just need a first aid, small dressings, but 70 to 80%, they are in need of hospital care. And 90% of these are in need of surgery. Most of them through limbs. Most of the time, we need to support people to save limbs, which is the most relevant injury. But also we can have injuries to the abdomen, to the chest, to the head. Next slide. Beside all that, and of course this is one of the nursing and other health personnel first relevance is that is to bring care to these people and wounded. It's also how we can support the field and the people, the nurses and the doctors who are working in this difficult situation. So in the specific, we have all these points that we will see afterward, each one in the specific. So we can provide training and capacity building, of course. We have provide resources and supplies to allow them to work properly. Security and safety, we have to guarantee. Mental health and psychological support, again, something that have been mentioned already before from our colleagues. advocacy and legal support, community engagement, technological and telemedicine, research and data collection, which is also another important topic, and of course, long-term capacity building. Next slide, please. Going back into the specific of training and capacity building, we have, as ICRC, developed with also in partnership with also other organizations as the International Federation of Emergency Medicine, WHO, and MSF, emergency care trainings. It's called BEC, Basic Emergency Course, to provide specialized training in trauma care, mass casualty management, emergency response. This to equip the nurses with the skill needed to handle specific challenges and conflicts in conflict setting. We have training on infection prevention and control to offer this knowledge and competence specifically in settings with high risk for outbreaks and communicable disease. Psychological support training, so training nurses to provide basic psychological support to patients, but also with colleagues, and continuous professional development, which is an important part of the ongoing education and training opportunities that we are doing through workshops, seminars, online courses like the one we are doing today. Next slide. Provision of resources and supplies. Of course, we try to enable people to do their job, not just giving the part of the training, but giving them the resources and the meaning to apply what they learned, which is most of the time one of the challenges in this context, in the context where we work, context affected by conflicts. We have mobile clinics and field hospitals, as I showed you before. We develop communication tool and we try to be in touch with our staff through community of practice for nurses and midwives. There is one specifically within the ICSC, but we are also part, or we are pushing our staff also to join the one that has been created by the WHO for that. Next slide. Security and safety support. We do security training, security awareness training to help nurses to navigate in the risky areas, to learn about how they can have a safe workspace, how can also local authorities, with which we have the dialogue, can establish and maintain safer zones for the health workers. We have been mentioned before by Dr. Cipriani that the Healthcare in Danger initiative is very, very important for ICN, but also for the ICRC and many other organizations to protect the healthcare personnel, facilities, and ambulances. And also evacuation support. Whenever there are problems, we need to provide the right resources to evacuate nurses or patients, their families, whoever is in need, to receive a safety place or to receive care in a safety place. As mentioned before, the mental health and psychological support, peer network support, access to counseling for nurses, for patients, for whoever is in need, families of nurses who are disappeared, who have been killed during their work. We have several incidents of healthcare in danger reported by the ICRC, but in many other organizations where nurses have been under attack and have been killed during their work, and trying to build resilience among those people, helping to manage the psychological toll of working in high stress and high risk environment. Next slide, please. Beside that, of course, we have also a wide range of advocacy and legal support for staff, but also for the authorities to understand what is protection and international humanitarian law, IHL, to emphasize the legal obligation of all parties in conflict to respect and protect the medical personnel and facilities, document or support the documentation of attacks on healthcare facilities, healthcare workers, which can be used also internationally to advocacy the effort to hold violators accountable, and legal assistance to provide legal support and advice to nurses facing legal challenges to their work. In most of the contexts, due to maybe malpractice because of lack of knowledge, lack of competencies, but we know that whenever we have a wounded person or a person in need, we as nurses, we are trying to do our best, and sometimes we don't have all the competencies don't have, or we are not given the possibility to have all the competencies and skills to save that life, and then we can incur in malpractice. Health education and outreach, of course, and volunteer mobilization. We are trying to mobilize a lot of the Red Cross and Red Crescent volunteers and volunteers in general, to support nurses in non-clinical staff, patient triage, administrative work, community health works, and promotion. Next slide, please. We have technological and telemedicine support. In these recent years, the development of the digital era is supporting us to develop and to implement telemedicine services, and most important, electronic health records for the management of the patient and the recording of the data. Talking about data, the research and data collection, which is very, very important to analyze the situation, the mortality, the morbidity of the patient that we are treating, and monitoring and evaluation. And at the end, but not the least, the long-term capacity building. So to support the local health system, which, as I said at the beginning, in most of the contexts might be affected and disrupted or non-existent, for the part of the capacity building, the continuous medical education in some contexts is not present or is not possible to be done during armed conflict, but the need of the health staff and the nurses are there in order to be updated, upgraded, and having the right competencies to treat the situation and the patient that they are receiving. Of course, the partnership with the local organization and within the humanitarian organization, it's very, very important, not to replicate, but to focus all the resources to work and collaborate together for the same aim. Next, please. So all these that we do as ICRC, but I think it's common to any other organization, can be also implemented in your reality, in your facility. You can pick 1 or 2 or 3 of these points, but any of that, it's very, very important to be developed and to be given as an opportunity for the health staff to access all these important points that I described, in order to have a good support for the immediate needs of nurses, but also to contribute to the resilience and the sustainability of healthcare services, specifically in war-torn zones or where the violence can affect the health system. Thank you very much. Next slide.
Yes, thank you. Thank you so much, Filippo. We certainly are grateful for the amazing work that you're doing. And often, as we've heard, certainly with restrained resources, as well as very high stress situations. Okay, I would like to next invite Melissa Hosian, who is the pediatric nurse referent for Doctors Without Borders, to present to us.
Great. Thank you. Just to mention, in my current position, I work to support nurses in the countries that we work, many who are living each day in really challenging contexts. So I hope that today I can do my best to represent them. Next slide, please. Médecins Sans Frontières, or MSF, or Doctors Without Borders, as you may have heard us referred to, we are an international medical humanitarian organization, and we provide healthcare in complex humanitarian settings to everyone who needs, guided by medical ethics and our principles of impartiality, independence, and neutrality. Next slide, please. Our activity is delivered where it's needed most, and these are in emergencies such as in armed conflict, but also in epidemics and in natural disasters, and also where people are excluded from healthcare. Guided by our principles, particularly our independence, which allows us the means to act when, where, and how we see we can have the most impact. And this is particularly important working in disasters or in conflicts, where an urgent response is often needed. We do not take sides or ally with any party in a conflict, and we carry out humanitarian action without discrimination of any kind. Next slide, please. In the over 50 years since being founded, MSF has over 450 projects in over 70 countries around the world. Our teams are made up of tens of thousands of professionals in logistics, in administrative, and also healthcare professionals, of which nurses and midwives make up the majority. Our last count was we have over 10,000 nurses globally. What you may not know is that most of our teams are hired locally. Internationally mobile staff, like myself, represent just 8% of our total global workforce. And our experience as internationally mobile staff will certainly differ to those whose colleagues, to our colleagues whose home, family, and place of practice has been or is being affected by an emergency. We need to be vigilant as to how the situation is impacting on them and the uniqueness of each context that we're in. Thus, I want to focus my presentation less on my experience, but more on those of my colleagues who are every day living this experience. Next slide, please. The 2020 State of the World's Nursing Report estimates that at least 6 million new nursing jobs need to be created by 2030, in which the largest of these needs-based shortages are predominantly in countries where MSF works, the African and the Eastern Mediterranean regions. And when faced with a disaster, these shortages are certainly compounded. And there's many contributing factors such as lack of educational facilities, access to education, weakened healthcare systems, and interruption to education for reasons such as conflict and population movement. And nurses may never have the opportunity to finish their qualification. Next slide, please. MSF nurses are a part of the communities that they serve, and they may have to care for their own family members, their own friends, acquaintances, the members of their community, or perpetrators of violence or hostile forces. And in conflict situations, this lack of security, the scale of loss and destruction, and the chaotic and frightening scenes have a major impact on nursing care. Mass casualties are common, and they often overwhelm already full facilities. Nurses may have to provide care within or close to active conflict zones, risking injury or death not only while at work, but when traveling to and from work, crossing checkpoints, and working hours according to curfews, which can result in longer working hours. And I wanted to mention as well here just about disease outbreaks, that there may be that additional fear and stigma and perhaps community misunderstanding of taking home the disease to those they're caring for. And this is certainly something that we saw during COVID and we're quite familiar with, but also something that we saw during the Ebola outbreak, such as the one in 2014 in West Africa. Next slide, please. As Filippo mentioned before, the supply chains might be affected and infrastructure might be destroyed. And part of our way to mitigate this risk is we have what's called emergency preparedness in the countries that we're in. So this again allows us to act quite quickly and try to respond to that situation as it's evolving. Providing care in whatever facility we have available at the time until we can provide a more suited facility. And this might be in a tented field hospital, in an inflatable surgical tent, or existing structures that might be partially collapsed or ill-equipped. And unfortunately, as we all know, that hospitals have certainly been targets. And these are not without challenges: the lack of space, patient confidentiality and privacy. How do we maintain and follow good infection prevention and control practices? They may be very hot, they may be very cold. Electricity, if it's available, might be not consistent or sufficient. And we need these for our basic nursing practice, for O2 concentrators, oxygen concentrators run by electricity, our lighting, sterilization needs, but also, if available, a blood fridge or safe storage of medications. We need access to water, and not only clean water, but sufficient amounts of water, and this might be contaminated. This is, again, for our basics: hand hygiene, personal hygiene for our patients, for the cleaning and disinfection of nursing equipment, for cooking and for feeding our patients, for laundry, for flushing a nasogastric tube even. One hospitalized patient needs 40 to 60 liters of water per person per day, so it's quite significant. And even in an emergency, we need to look at our waste management. Is it safe? Is it environmentally friendly? Is it sustainable, in a way to avoid any potential future disasters? Next slide, please. So in these challenging times, we often work in survival mode. We often work very task focused and what we need to do just to get through that situation. But how do we as nurses continue to keep our patients at the center of what we do, while also not neglecting ourselves and each other? So I hope I've provided a bit of a unique perspective to it. And I would just like to conclude with a message, and I'm going to hand over to my colleague Anis from Yemen, and hope that the video works for you all. Thank you.
أصبح العالم كثير الحروب، كثير الكوارث، الأحزان أصبحت تعصف بهذا العالم الصغير. لذا أن تزرع ابتسامة في فم حزين ومحتاج سيكون شيء جميل جدا. ستشعر بالرضا بالنفس وستشعر أنك إنسان بمعنى الكلمة، تمارس إنسانيتك سلوكا. أنا أنيس عبد ربه ديان، اشتغلت في مشروع أطباء بلا حدود Trauma Center.
Thank you, Melissa. Again, really instructive to learn about the ecosystem in which you're working, and also the important point that he was just stressing about caring for our carers, and the challenges in the other personal safety and fear and other psychological needs that our staff need. I'd like to turn now to Dean Antonio Villarreal at the University of Pennsylvania, who's going to give you some comments on extending support and solidarity as recommended by our 3 school sponsors.
Great, thanks, thanks Pam, and thanks to all of our presenters. We certainly are, I don't know what the word is, humbled, shocked, saddened for all of the trauma and all of the experiences that are being faced by not only nurses, but also by those that you tried to serve in that particular area. So this was the impetus for the 3 of us coming together to say, what is it that we can do as a community? And I'm certainly heightened, or certainly happy to see that the work that the ICN is doing in those areas, and grateful also that our colleagues have identified areas of support within our own schools and universities. Next slide, please. We did identify areas that we could work to support nurses in conflict areas, and these fell under 3 different buckets. And I think the first one is technical assistance. We have a number of our students, our faculty, alums, and our scholars who are have a way that they can contribute to addressing some of the issues that you have. So we have structures in place like capstone projects, and again, just work that our nurses want to do to be able to support you. So again, technical assistance and many in the areas that you did. We can also provide support in terms of trauma-informed care by training for providers who are experiencing trauma, and also human rights issues. Many of our universities have research and fellowship opportunities where we can actually have nurses from these conflict areas come and work and learn in our environments. And finally, we are happy to participate in fundraising initiatives, mobilizing our students and faculty and alum to provide support through conflict, through Nurses for Peace, but also in other areas as well. So again, we look forward to working with ICN, with our WHO collaborating networks to, again, support our nurses in solidarity. So thank you.
Thank you, Tony. What we would like to do now is to have a few reactions, but I would first ask Dr. Sandra Davis, who's with the National League for Nursing and also is the chair of ICN's Educational Experts Panel, to comment a little bit about the education perspectives, because we know that this is a helpful way to assist in our countries. And then we will have just a few more reactions. So, Sandra.
Yes, thank you very much, Dr. Cipriano. Greetings. I am grateful for the opportunity to participate in this critically important webinar. Thank you for the sponsors of this event and to today's extraordinary presenters. In 2023, the International Council of Nurses, ICN, and the National League for Nursing, NLN, formed a strategic partnership to prioritize the education of nurses worldwide through the formation of the ICN Education Experts Advisory Committee, known as ICNEE. The aim of the ICNEE committee is to promote the education of nurses around the world to ensure that the nursing workforce of the future is prepared to meet whatever challenges lie ahead. I chair the 14-member ICNEE committee that is comprised of 2 nurse educators from each of the 6 World Health Organization regions. I surveyed the committee to get their input and their recommendations on 3 pressing questions for nurse educators that reflect the purpose of today's webinar. The questions were: what types of educational programs are needed to support nurses in conflict areas? Are you offering educational programs to address training needs? And then 3, how can nurse educators best advocate for nurses in conflict areas? The responses were immediate, coming from Canada, Lebanon, Spain, United States, Rwanda, Peru, Oman, thus demonstrating the interest, the support, and the critical need for today's event. Now, I'll share some of the responses with you. For the first question, what types of educational programs are needed to support nurses in conflict areas? Respondents said, first, there needs to be a compassionate curriculum, one with knowledgeable educators that teaches not only skills in trauma, emergency, acute care, rehabilitation, and disaster response, but also a huge emphasis must be placed on schedulized training that focuses on mental health, psychological and emotional challenges, and preparation for the intensity of the moral tensions and the ethical decision-making that occurs in critical situations. Also highlighted was the importance of leadership, communication, and teamwork. They were identified as essential for training and development. In response to the second question, are you offering educational programs to address training? Most schools are not. One respondent said that they offer it based upon a needs assessment. Now, while most schools do not offer specific educational programs, the nurse educators are familiar with global relief efforts, specifically mentioning the organizations represented today. And also they recognize the need for collaboration, ongoing collaboration. Now, the overwhelming response to the third question, how can nurse educators best advocate for supporting nurses in conflict areas, was raising awareness, and more awareness. And raising awareness through forums for discussion that lead to a shared understanding of how to support nurses in conflict. In addition, other responses including advocating for funding and for policies that promote the health and the safety of nurses in conflict areas. The global reach of the ICNEE highlights that nurse educators from around the world are concerned and are interested. Thank you.
Thank you, Sandra. I'd like to call on Cheryl Peterson from the American Nurses Association, who's going to give you a reaction to the previous presentations.
Thank you, Pam, and thank you to all who attended today. This is a really important topic, and we appreciate the opportunity to partner with ICN and the other schools of nursing as we talk about this topic. For me, what stood out in this whole conversation is, one, the importance of tailoring the response to any event in a conflict or disaster. There is no one response that's going to fit all situations. So I think it's really important that before you act, we think and we collaborate to make sure that what we're doing really is going to meet the needs in the either in the disaster zone or in the conflict. And for that, we so appreciate the role of ICN in serving as a coordinator. We know that they are in contact with the member associations from those countries, and that therefore they serve as kind of the connector, and we're not trying to reach out or connect with people who are already very busy doing the work they need to be doing, and ICN can become the coordinating role. And that's so important because, one, they can help to guide us in what's most useful and effective, and they can help us to facilitate getting whatever is there. The other important thing is it stops us from doing something that's not going to be helpful and then puts an added burden on that, on the country where the conflict or the disaster is occurring. So thank you very much. Thank you, ICN, and appreciate this effort.
Thank you, Cheryl. So if we could have all of our presenters back on this front display screen. Like I said, unfortunately, we are running behind schedules, so we're not really going to be able to answer a lot of questions, but I wanted to just make sure that we display all of our presenters again. Let me start with just a quick question for Melissa. And the question is, does MSF utilize nurse practitioners?
Yeah, indeed. And I think because we work across so many different countries and the nursing education and qualifications vary significantly, certainly in some countries we do as recognized, and in some countries nurses are working as advanced practice nurses within those competencies, but might not officially be recognized as such.
Thank you. And we had a couple questions that dealt on some of the things that were touched on in terms of trauma support for the individual nurses and other caregivers. And if one was also, is there research that people could share about maybe studies that are underway or that have been fueled by an interest in looking at nurses in conflict zones? And then I think, Melissa, you mentioned briefly support for caregivers, but maybe if you and Felipe could just very briefly address what you know to be happening in that regard.
I'm not aware of any studies from that regard, but that's just within my own personal experience. I'm not aware of any specific studies, but I think the psychosocial impact is something that really needs to be addressed in the acute phase as well as the long term, and really addressing it in that acute phase is going to prevent any further complications or development of disorders along the way. And I think it's important that we look at nurses, but we look at our patients and we look at their caregivers as well, and really have that psychosocial support for everyone at that acute phase.
Great.
Yeah, and if I may intervene, I think I'm on the same line with Melissa. I think that there are I'm not aware, but I believe there are not many studies on that, also because the collection of data or the stuff to collect and the mental health stuff, there are not so many psychologists in many of the countries where we are working. This is a profession that is not present or not so much developed, and in prone areas zone. War-prone zone, the situation is so tense and difficult that the first aid that is given is, of course, the aid to the people, and the mental health comes as a second step. But absolutely, it's a very important thing to do and to develop.
Great, thank you very much. We had another question about advanced practice roles. And again, I think, we are seeing that yes, scope of practice is really important in all roles. This is obviously a very team-based effort that we see. And one of the other questions is, how does a new nurse think about getting ready should they want to work with either of your organizations as a indirect relief?
Well, for the ICRC, I mean, we have mobile staff, so-called expatriates. We are working very much directly with the Ministry of Health of any country we are working with. So whatever staff we are finding in the MOH system, we are trying to work with them and to elevate their knowledge and competencies to reach a good level of care, a good level of quality of care. And I believe that also the guidance given through the ICN also documents and other documents to align also the academic studies of so many institutions that are around the world. But at a certain point, we need to reach a level where everyone is able and competent to do their role. Melissa mentioned before that sometimes we have nurse practitioners who are doing advanced job, or some people are required to do something that is out of their scope or their role. And this sometimes might be also leading towards malpractice if the people are not equipped properly. So we need to push towards a capacity building and to grow the competencies of these people, and to recognize also at a certain point this knowledge acquired.
Thank you. Are you saying just agreeing, Melissa?
I said perfect. Yep.
All right, great. Well, we have definitely reached the end of our time, and I apologize that we weren't able to get to a lot of questions. But I do want to acknowledge we had many comments and direct questions, both to individuals on the panel as well as ICN in general, about the current conflict that is addressing Palestine and Israel and the people in Gaza. We want to remind you that our approaches are to really support the humanitarian needs of all people, and very public statements with our organizations around the world to support the safety of healthcare workers, to keep them out of danger, again, to support ceasefire and ways in which we will see an end to the conflict, and again, support for all the humanitarian needs. None of us believe these are simple issues, and recognize that there are very strong feelings, but everyone shares a deep sense of the need for humanitarian support. So I would like to turn it over to Mark for just another concluding comment.
Yeah, thank you, Dr. Cipriano. Conflict is inherently political. It affects nurses and people on all sides. And we're grateful that the approach of the MSF, the ICRC, and the ICN is to care for all people and to support all nurses affected by conflict. I want to express my gratitude for you attending this webinar. We hope it will inspire you and all of us to support our fellow nurses. Please consider donating to the International Council of Nurses, Nurses for Peace initiative. You can follow their hashtag there and go online and make a donation today. Every contribution helps support nurses in conflict areas. We look forward to hearing from you, and you will receive a post-webinar evaluation and email along with instructions about how to access the recording. Thank you all very much.
Thank you.